welcome back. Good Day with Olivia starts right now. I'm your host, Olivia Winstead, here serving up the good news happening right here in the city of Cleveland, keeping you informed, engaged, and connected. Cleveland, the rates of obesity in the U.S. are high, and so are the numbers of preventable deaths attributed to obesity. Do you have questions about about obesity, like how to fight it, how to prevent it, or where to get started and seek help? Well, in the studio today, I have obesity specialist here, all the way from the Cleveland Clinic, right up the street, here to share all and give us all the answers. I'd like to welcome to the studio this morning Dr. Karen Cooper. Welcome to the studio.
Thank you, Olivia. It's great to be here.
Yeah, I'm glad to have you here. You're off. They don't have you working today at the clinic.
Not at all.
I'm sure they keep you busy during the week, though.
Pretty busy.
Yeah. Well, we're glad to have you here in the studio. Before we jump right into the topic, it's time for some news updates. Cleveland, if you have been following the story of the 12 boys who were lost in a cave in Thailand with their 24-year-old coach, I have great news this morning. They were rescued. So good news for Thailand. And to all the beehivers out there, guess who's coming to town in the next week? That's right, Beyonce. So I hope you guys are ready to kickstart her concert. My guest from last week, Austin Kirkland, will be hosting a Beyonce brunch. So if you're not following him on Instagram, go follow him now at Millennial Pro and get more details about the event, and hopefully you'll be there. Back to you, Dr. Karen. So, are you a Beyonce fan?
Let's start. Absolutely. Oh my goodness.
I love Beyonce's hair. I'm into big hair. So I don't know if I'll make it to that concert or not, but I might make it to that Beyonce brunch. But anyways, are you a Cleveland native? Let's start with your background here in the city. Where are you from?
So my background, I've been here for about 17 years. So I like to call myself a pseudo Clevelander.
Ah.
But I'm from D.C. and I've also lived in New York.
Ah.
And I originally came from Guyana in South America many years ago.
Many years ago. Yeah. How many years have you been in the U.S.? Were you born in Guyana? Is that?
So I grew up in Guyana. I actually was born in England. So anyway, another story, another interview. But yes, I grew up in Guyana, and then I came to the United States to further my education. And so I've been here for more than 20 years.
Yeah. Do you like it here? You must.
Oh my gosh, yes. I absolutely love being here.
Yeah. What do you enjoy most about the city of Cleveland?
Oh, wow. Cleveland is very friendly. Yeah. And it's very community oriented, very welcoming. So living in the Northeast for a long time and then coming to Cleveland, Cleveland just felt like so much love.
Yeah.
People are just warmer, wanted to talk more, connect more, and so on, is what I felt. Maybe it's true in the other places, but that's what I felt.
That's what you got here.
Mm-hmm.
That's
and
awesome.
Then I found out that Cleveland has a lot of lovely, eclectic places. I think it's the place that people don't really realize is a wonderful place to live.
Right.
Cost of living is great. There's so many things to do here. And the education is great here. If you're in the medical profession like I am, there's so many opportunities for that here. So,
Case, Cleveland Clinic.
Yes.
Yeah.
Yeah.
So where are some of your favorite places to go? You said there are lots of things to do that people don't realize are here. What do you enjoy doing here in the city?
One thing we have in Cleveland, more so than some of the other states, is that our museums pretty much are free. Most of our museums are, and so I love going to Cleveland Museum of Art. I love going there. I love looking at the exhibits, you know, and my favorite places always are the gift stores.
Wade Oval is beautiful.
Wade Oval is also very lovely. And then during the summer, there's so much to do during the summer, which I think, Cleveland likes to make up for the long winters.
Yes.
And so the summer is just always packed with so much.
Yeah.
There's a lot to do in terms of the water. There's a lot to do in terms of, just hanging out socially. bars, restaurants, always new places to go to or former places that you enjoyed. There's always something going on in Cleveland that you can find, and always information about it on social media or, cleveland.com or something, just to let you know what's up and what's going on, even if you're new to Cleveland.
Right. So make
Yeah.
sure you're following Cleveland on
Yeah.
Instagram, Twitter, and Facebook. We do have events like almost on a daily basis. There's something going on
Yeah.
downtown here around the city. But anyways, let's talk about your overall Cleveland experience here over the past 20 years. What's it been like for you?
Well, 17 years.
17. Okay.
So when I came here, actually, I needed to complete my residency in family medicine. And that really only required a little more than a year. And my goal was to get out of Cleveland as soon as possible
Oh.
and head back east.
Yeah, I heard about that. We'll talk. We're going to address that later.
However, I got my dream job. And and I also have family here that I adore, and so the combination of the two, was a natural call to stay.
Yeah.
And so I didn't give it any thought. I just kept going, and I'm still here.
Great.
Yeah.
So, what you work for the Cleveland Clinic?
Yes.
What is it that you do? We know you're an obesity specialist. Is that your title? Do you wear some other hats? What other things are you doing in the Cleveland Clinic, or what is your official title? I don't know if I got it or not.
My official title is Director of Weight Management Programs in the Women's Health Institute at the Cleveland Clinic. However, I also enjoy public health, and I really enjoy global health. And so I like to do a lot of medical mission trips. I go back to my country of Guyana, and I do that there. But I've also gone to Peru and Guatemala and Nicaragua and El Salvador and Ghana and Jamaica, just to do some medical missions, whenever I can.
We're gonna talk a little more in depth about that.
Mm-hmm.
What are you as a is it weight management director? Weight.
So, we could just call me an obesity specialist.
Oh, no, okay, we can.
Right?
Okay, as an obesity specialist, what is it that you do on a daily basis? How are you serving people?
So that's a great question. Since I'm in the Women's Health Institute, my focus is women only. And what I do is I will assess someone who meets a body mass index that is compatible with obesity. So that would be 30 and above. And so if someone comes to me saying, I've got a weight issue, I'm having difficulty losing weight, I've tried everything, then first a medical assessment occurs. What's going on with the person, what medicines are they on, what are their lifestyle behaviors, genetics also plays a role, so family history is important.
Yeah.
Current medicines that they're on could be promoting weight gain also. So a full medical assessment is done, right? In addition to behaviors and past successes and failures with weight loss to determine what the plan of action should be for the person.
Are you one of the only obesity specialists at the Cleveland Clinic? Are there others?
Oh, there are others.
Okay.
But I'm one of the first.
Ah.
Yes. In terms of this field, because this is not obesity medicine or bariatric medicine is not a board certified specialty.
Interesting.
So when this came about, I was one of the pioneers who began doing it because it was needed.
Wow.
So my call to serve at that time, and still now, but really truly at that time, my call to serve was to make sure that people who underwent bariatric surgery also had a good transition into the non-surgical aspect.
How did you get started? Where did your journey begin?
It really began coincidentally. And by that I mean I was finishing up my residency at University Hospitals, Case Western, and there was a surgeon who was promoting an informational session on weight loss surgery. And because I knew that I wanted to follow people with weight issues, even during my training for family medicine, I stopped by. And what I saw was amazing in terms of the amount of people that really needed his help. And then what I realized afterwards, because I went up to him and I asked him if I could shadow him for a while. In the shadowing of him, I recognized that there's this gap between what the surgeon does and what needs to be done for the patient after surgery. And so I started searching for that.
Wow. And you said this happened coincidentally. You know, every time I'm talking to my guests, they always say, you know, I planned to do this, but I ended up doing this. It's always so funny. Like, we make plans, but really and truly, the plan makes us.
Yes. You're absolutely right. I would say that this plan made me.
Yeah.
I mean, it really, being here in Cleveland does not feel, it feels more divinely inspired.
Yeah.
You know, than anything I could have come up with on my own.
Yeah, that's awesome. Now let's get more into obesity and what it is. You kind of outlined it for us, but why don't you tell us again what does it mean to be obese?
Okay, so right now we are using, and when I say we, I'm talking about the medical profession, National Institutes of Health. The medical guidelines state that we should utilize the body mass index, which is a calculation of your height and weight that gives us a number. We should utilize that to give us an idea as medical providers where someone is on the weight spectrum. It is not completely accurate. That's something that needs to be known, because you can have a body mass index of 30, which says you're obese, but you might not be if your muscle mass is high, right?
I see.
So you can run into athletes who have high body mass indexes, but they're not overweight or obese in terms of what the definition of a body mass index is, because their percentage of muscle mass is so high.
When their doctors are treating them, do they consider that when they're dealing with someone who is athletic? Will the doctor consider that, or will they just begin treating them based on what the BMI comes back as?
I think it's if there is an associated disease with the body mass index, that's a flag for looking at this a little bit more closely.
Okay.
But everybody, yes. And so if someone's muscle mass, though, is higher, much higher than you would see normally, because that person's an athlete, then they're going to also look very athletic as well, right? So unless something is connected to it that signals a red flag, it may not be addressed.
Gotcha. Yeah. Why is obesity defined as a disease?
Well, because it is, right? It is, and it spurs so many other complications and issues. When someone is overweight or obese, they're at higher risk for many diseases, like sleep apnea and diabetes and hypertension and cardiac diseases and strokes and, you know, a lot of things that we are trying to ward off or be preventative about. And once the person falls closer to their ideal body weight, these other diseases disappear.
Yeah.
So obesity in itself, which is a very inflammatory state, tends to promote these other diseases, and so it is rightly diagnosed, called a disease. It's a chronic disease, actually.
Interesting. Could you give us some of the obesity stats here in Cleveland? Where do we rank on the obesity scale?
Yeah, so Cleveland, or rather, it's ranked in terms of the state, Ohio. Ohio ranks 19th in the nation, right? And so we're a little bit better than we used to be, but we still have a lot more work to do. And so percentage-wise, a little more than 31% of our population in Ohio are obese. So that's what that means.
Yeah.
Now in terms, and we're talking overall, but when we look at our children in Cleveland, we've actually done a little bit better with the toddlers, the ones from 2 to 5 years old. Those rates have dropped because of all the efforts that have been made, the policies in place that have really been pushed in schools and daycares and so on and so forth. Those have really made a difference. And so those numbers have dropped for the kids.
Why, number 19 out of 50 states, that's pretty high. that's still pretty high, even though we've come down a
Hmm.
bit. What
Yeah.
are the underlying issues? Is it the weather, like that's keeping people from going out to work out? What's going on?
That's a great question. The weather does play a factor because when winter hits Cleveland,
Oh yes.
we hibernate, people, and it's not just Cleveland, it's everywhere. Hibernation occurs. You're slower in the winter. You don't want to move as much or go out as much and so on. And so it's easier to gain weight. And we're also eating foods to keep us warm and, that
Mm,
are denser, heavier. And so that's part of it. But it also has to do a lot with your environment because the studies have shown that poverty also plays a role. If
interesting.
you are living in an environment that where poverty is high, then what you will also find is that there's not great access to parks, recreation centers, green space where you can move around not only a lot but safely. And then also in terms of grocery stores, and there are more fast food restaurants and convenience stores within areas with a lower socioeconomic status. And so poverty plays a huge role. It's our environment as well as behaviors, as well as the weather. It's a lot that plays into obesity increasing and escalating.
Does mental health tied into it?
Mental health is definitely tied into it, I feel. I do feel that um, a lot of our obesity is also fueled by the abundance of food,
Mm,
as opposed to 100 years or so ago, where you know we we looked at food differently, we got our food differently. Um, Now we have such an abundance of food at such good prices,
mm,
and our portions are larger. And so I think eating disorders have been built around that in a sense. There's food addiction,
yeah.
where you're addicted to certain food types. It changes the neurotransmitters, the chemicals in your brain, and that starts another cascade of behaviors and um, issues that's very hard for the person to override on by himself or by herself.
Considering that,
Mm-hmm.
what you just said,
Mm-hmm.
and the fact that obesity is a disease,
Yes.
does it take a doctor to treat it or reverse it? Is it as simple as just starting your own diet plan and just going out there to work out? Because a lot of people just do that. Like myself, that's how I got started first, but I
Yeah.
did end up consulting my doctor.
Yeah.
Is it necessary to, if you're obese, is it necessary to seek treatment from a medical professional?
Well, what we've found is that a team approach is very, very helpful. So, yes, we can all start on our own, if we feel like we're overweight or obese, and we can start on our own. We know that if we change our diet, maybe that's an issue, if we exercise some more. But there are also genetic factors that are involved,
Yeah.
as well as, like I said, there are the eating disorders that are also involved. Then there's the environment that's involved, and someone may not have the ability to really analyze themselves from all of those perspectives to come up with the right, I shouldn't just say the right, but come up with a plan that will help them evolve into where they'd like to be.
Right.
And so the team approach would require always a dietitian,
Mm.
perhaps a consultation or conversation with someone in exercise physiology, um, a physician or a medical provider who can not only assess you, give you a medical assessment and evaluation, but also if you require medications to help or
Exactly.
require surgery to help, that's where those conversations are incredibly important and critical.
And that's exactly what I wanted to point out,
Yeah.
because there could be some underlying issues, health issues that you're not even aware of,
Yes.
that's causing the obesity, or
That
obesity
could
may be affected.
that could be promoting it. For
Yeah.
instance, sleep apnea.
Yeah.
Right? Sleep apnea is a situation where you are not getting enough oxygen to your brain. And most often it is caused by excessive weight gain, but it can be caused because there's an anatomical problem going on within within the sinus region and so on. However, when you have sleep apnea that is not diagnosed and not treated appropriately, the symptoms make you so fatigued during the day, right, that you hardly have enough energy to move, to do the activity that's required. And when we're tired, what do? We grab for things that are sugary, we grab for things that are caffeinated to give us that boost so we can keep the day going. And that cycle keeps the weight increasing.
Digging us in a bigger hole.
Yes, it's a bigger hole that's being dug.
Callers, if you have any questions, feel free to dial in. Mr. James, what's the number to dial in?
Well, Olivia, that number is 216-298-1554. 216-298-1554, and I'll post it on the live feed.
All right. If you have any questions, Dr. Karen is here to answer them. So many of my followers on Facebook and Instagram, they reached out to me. They knew you were coming on the show, so they had some questions. One that stood out to me. Someone asked, well, a few people asked, are weight loss pills effective? Are they safe to assist in weight loss?
Okay. So the medications that we have now, unfortunately now instead of just one, we have about 4. And I laugh at that because for every other disease process, we have so much more to choose from. And with weight loss, it's just about 4. They are effective, but they're only effective in relation to how you're going to work with it.
Okay.
And so very often people tend to rely primarily on the medication. But if you are not doing the exercise activity and not making the diet changes along with the use of the medication, you're really not going to see that great weight loss.
Okay. And are you also including over-the-counter medications people can pick up at Walmart?
No.
No. How do you feel? What's your opinion about those?
Well, I think that if those worked, we wouldn't have an obesity problem.
Right. What are some of your tips for a healthier lifestyle?
Always exercise. If you can, always move. Move as much as you can. Whether it causes you to lose weight or not, the exercise activity itself does so much for you that it by itself is a wonderful thing to do for yourself in terms of promoting health.
Yeah.
So move as much as possible. But when we're talking about weight and exercise activity tends to be very helpful in helping you to maintain your weight. It can help you promote weight loss if you change your diet around. It can promote more weight loss than just being on the diet alone. But if you like where you are in terms of your weight, exercise activity will keep you there. Regularly scheduled exercise activity will keep you there.
Yeah. And because we were talking about mental health and how it's all tied into obesity. I think, I'm in a better mood when I get my workout in. Seriously, like if I don't get to unwind after work, like and go to the gym, when I miss a workout, that puts me in a terrible mood.
Yeah.
So I think it promotes mental wellness as well. Am I correct about that?
You're absolutely right. It elevates the endorphins, right? The good feel endorphins, and so. That's another reason. I mean, like I said, exercise on its own does so much. You feel great. It lowers the blood glucose. It controls your blood pressure. It raises your cardio respiratory function. It just does so much for you. So your circulation, oxygen. It does so much for you.
I think we have a caller.
Yes, we do. Go ahead, caller.
Good morning. Good morning.
Good morning.
Happy Saturday. Good morning. I just had a question. I've been on atenolol, which is, of course, for hypertension, a blood pressure pill, and I find it extremely difficult to lose weight. Is there a different, maybe, approach I should take if you're on blood pressure pills? Thank you so much.
So it sounds as if, what I'm assuming from the caller, she thinks that the antihypertensive, the atenolol that she's taking, is preventing her from successfully losing weight. Some medications can promote weight gain. That's why you need a medical assessment. I think atenolol can do that a little bit. However, being on the right diet plan can also still promote weight loss.
See, I can't hear her.
You can't hear it? Can you hear it now?
I can hear you.
Can you hear me now?
Yes.
Oh,
Absolutely.
great, great.
Thank
Um,
you.
yeah. So it sounds like you feel that the Tylenol is preventing you from losing weight, correct?
Yes.
Yeah. And why do you think that? Have you noticed an increase in your weight since you've been on it?
Yes.
Okay. It's true that a Tylenol can promote some weight gain. However, are you also dieting along with being on the Tylenol?
I have, yes.
You have. And what about your exercise activity?
I try to increase it. Now, I'm not in the gym a lot, but I do try to walk all the time.
Yeah.
I get up every hour from my desk and walk for 5 minutes. That's what I try to do.
Yes.
Um,
And so the first thing I would do if I were you is have a conversation with your healthcare provider. You can
okay.
talk about saying, since I've been on this medication, it seems as if my weight is increasing and or I'm not able to lose weight like I used to. I think it might be the medication. Is there any possibility of us using an alternate medication? That's one of the first things you can do. But the other thing you can also do is meet with a dietitian and have them assess your diet to see if there are areas that can be changed around to promote better weight loss for you.
Okay.
Hmm.
Well, thank you,
Okay.
caller.
Thank you for
Thank you.
calling in.
Bye.
All right, that was like my first caller on a on a show. Period. Thank you. So let's talk about what you're doing to educate the city of Cleveland to get them up in knowledge on obesity. How are you reaching out to the community?
So I do love community outreach a lot. So saying yes to your show, I say yes a lot. So Dr. Linda Bradley, also the Cleveland Clinic, also in Women's Health Institute, has a program called Celebrate Sisterhood, where she does a lot of wellness events. And very often she'll ask me to be involved, and that's another avenue. Usually I don't say no unless I'm completely unavailable. If someone says, "Can you come and have a talk or do some exercise activity with us?" Because I do that as well. I say yes because I think it's really important. Well, first of all, I love this. That's the thing. I love this.
I can tell.
But I also love educating. So actually, to be honest
Yeah.
with you, this year it seems I've had many more students with me than I've actually been out in the community.
Ah.
I've had a lot of people call and ask if they can shadow, if they can observe, which I think is really important because we need to educate the next generation
Yes.
of providers coming up, whether they're dietitians or exercise physiologists or public health aficionados.
Yeah.
They need to know, and so I like to do that whenever I'm asked
I
to.
think that's amazing. Your work is awesome,
Thank
and
you.
your work goes beyond just serving the city of Cleveland. You've traveled pretty far to get your messages regarding health.
Yeah.
You've traveled to places like, where have you been?
Yeah, so as I was saying earlier, I've been to Peru
Yeah.
and Guatemala and Nicaragua, my country of Guyana in South America. I've been to Ghana in Africa, El Salvador.
What are you
Gosh.
doing in these countries?
And so in those countries, I am practicing family medicine, and I am trying to give medical care where there is very little access.
Awesome.
Yes.
And you're taking special initiative in Guatemala as far as child welfare
Yeah.
and gender rights. Yeah.
Yeah, that was really awesome. That was amazing, and that came through Case Western School of Social Sciences, where I was invited to go as faculty along with the social science masters and PhD students to have a look at child welfare there, and that was amazing. It was certainly educational for me, more so than doing hands-on work, and they definitely have a place in my heart now, another area to keep going back to.
I'm gonna need an extra minute. Now, you said earlier, you once said that you were never gonna live here in the city of Cleveland, and you're here. And I think Donna and Stewart had a lot to do with that. Who are they? And how did they change your mind?
So Donna is my sister. She's my big sis. And Stuart is her husband, my brother-in-law.
Ah.
And it's because of them that I chose Cleveland as a place to look at when I was looking at residencies. And because they were already here and very well established, it was easier to transition from Washington, D.C. to Cleveland.
Yeah.
And so, yes, they have been incredibly influential in me enjoying Cleveland and knowing a lot more about areas of Cleveland and wanting to give back in the way that they enjoy giving back also here.
We're going to end it off with, what's your overall goal as a health professional? What's your goal?
Prevention. If I can prevent, oh my gosh. And if I can prevent